Hello, my name is Dr. Robin Murphy, and I'm a naturopathic doctor and the scientific advisor for DNA Labs. And I'm happy to announce that I'm going to be joining the team at ACE Sports Clinic. So I wanted to introduce myself as well as tell you a little bit about the genetic testing that's going to be offered now at the clinic. So the type of testing, genetic testing that we're going to be implementing is called lifestyle genetic testing. So it's a little bit different than if you were going to the hospital to get diagnosed with a genetic-based disease, such as breast cancer or ALS. This is more related to lifestyle diseases. So what that means is that many chronic diseases that we see, diabetes, heart disease, even weight gain, high cholesterol, all of that can be influenced by our environment, obviously, by our lifestyle. So your diet, your exercise regime, the amount of stress that you're under, but also we know that there is a family history. And this gives us indication that it is genetically predisposed as well. So when we look at your unique genetic makeup, we can understand all those environmental factors as well as the genetic factors that can contribute to developing these diseases. So with this information, it can help us to really unpack what is the best treatment protocol for you based on your genes, and what are those key lifestyle interventions that need to be implemented in order to ensure that what you're doing in your lifestyle has the biggest effect. So for example, we see that heart disease, high cholesterol, not everybody responds well to a Mediterranean diet in lowering their cholesterol. When we look at exercise regimes, maybe you're exercising on a regular basis, you're noticing more swelling or injuries or inflammation, or maybe you find that there's stubborn weight loss. This could be an indicator that the type of exercise that you're doing may not be the best for you based on your genetic makeup. And so this is the type of information that we can glean from a lifestyle genetic test. So there's 8 different sections within the test. We're looking at particular diets that can be individualized to you. So how much protein should you be consuming? How many carbohydrates? What type of carbohydrates? And how much fat should you be consuming? Is there any risk for nutrient deficiencies? We know that long term, if people are undernourished, this is what leads to chronic disease, as well as things like vitamin D. With that can contribute quite a bit to risk for depression, obviously osteoporosis. So we're looking at a number of different vitamins that you could be at an increased risk for being deficient in. We're also looking at risk for obesity, hormone pathway and detoxification pathway, as well as physical fitness. So are you at risk for certain tendinopathies or tendon-based injuries like ACL? Do you need more recovery in between your exercises? Or do you create more inflammation? Or are you more prone towards, or do you have an advantage towards endurance versus power types of sports? So all this information can help us to really understand, your unique makeup and come up with a treatment plan. So the way that it works is you will come into the clinic, or we can send the test to you. It's a very easy test to do. It's just a cheek swab. So you just take the swab on the inner side of the cheek, make sure there's no food or fluid intake about half an hour before. You'll put that into a stabilizing solution and send to the lab. And the results will come back in about 2 to 3 weeks. So when the results come back, that's when you'll book a consultation with myself. We'll go over the results as well as your past medical history, your family history, and any other pertinent information that I think would be helpful to identify what are your goals, how can we utilize this information, and then what follow-up testing do we need to confirm that these genetics are having a big impact on your health and your current symptoms. And then we'll look at prevention as well. So at the end of the consultation, you'll receive a brief summary report that will highlight your key factors from your genetic test that we're going to focus on. And then thereafter, you'll come back. We'll follow up on some of the testing that we may have done, blood tests, for example. And at that point, we'll discuss what your treatment plan looks like. And this will be geared towards addressing those genetic factors as well as your unique biochemical processes that are going on, looking at a full review of systems to understand, is it your digestion? Is it your nervous system? Is it your hormones? How these are interacting together to affect your health. And we'll come up with a plan. So I look forward to working with you, and I'm very excited, as I said, to be joining the ACE Sports Clinic. And hopefully we'll see you in clinic soon.